3 lifeline services keeping people healthy, which could also prevent them needing time in A&E, must stay. That's the key theme of a new report by Healthwatch Norfolk, based on hundreds of survey responses. Healthwatch Norfolk was asked to analyse and report back on plans for the future of the Norwich Walk-In Centre, the Vulnerable Adults Health Inclusion Hub, which offers GP support to people with no fixed abode, and the GP out-of-hours service. Although health bosses decided not to progress with any changes midway through the consultation, we continued with the survey to demonstrate people's views of the services they're being asked about. A total of 2,100 people sent in completed responses through face-to-face consultation and online surveys, and formal responses were also received from a number of different organisations. Healthwatch Norfolk also conducted face-to-face sessions with adults in vulnerable situations and the staff who care for them to get specific information about use of the Vulnerable Adults Service. People leaving feedback all raised concerns about the impact of the service changes. They said reducing the GP out-of-hours service would make it difficult for those to get help, particularly affecting people in rural areas, older adults, disabled people, and those with no access to public transport. This would divert more people to A&E or emergency services, increasing pressure there. There was similar feedback around the Norwich Walk-In Centre. People told Healthwatch Norfolk it provided vital same-day care for those who couldn't get an appointment from their GP. They also feared proposals to reduce operating hours or close the centre would limit access to care, increase waiting times, put more pressure on hospital emergency departments, and were also sceptical if any cash savings being diverted to GP practices would actually mean more available appointments. Meanwhile, the Vulnerable Adults Health Inclusion Hub was seen as a lifeline, literally in some cases, for people who are homeless, isolated or have complex health needs. Most felt it should stay where it is, rather than moving to a mobile service as people know where to go. It provides consistency, and patients would struggle to find it if it was moving around. Many of those taking part in the survey, which was designed by NHS Norfolk and Waveney, also found it difficult to complete, with respondents leaving the questionnaires unfinished due to the repetitive nature of the questions and confusion caused by their wording. As a result, around half the people who started the surveys failed to leave full responses.
I think the thing that stood out the most for me, and we heard repeatedly throughout the conversations that we had, were that the people that were using this service had tried to engage with healthcare in different settings previously and had just been unsuccessful, which had led to some of them having long periods going without adequate healthcare. But however, since engaging with VAS, they were having their health needs met and were able to access care in a timely manner with people that they trusted in a familiar location. And many of them said to us that they just would not be having their health needs looked at or seen to or monitored had they not been able to access VAS. And I think as well, something that the staff mentioned to us, which was important, was that the presentation of some of the people who use VAS could be, it's complex. A lot have complex health needs, and in a different GP setting, for example, where the appointment times are shorter, there is the risk that some of the underlying issues, such as perhaps an undiagnosed learning disability or different acquired brain injuries, for example, may be missed and may be seen as their symptoms may be allocated to some other condition. So, with VAS being able to offer longer sessions and having already built that trust with their clients, they're able to fully address all of the complex health issues which perhaps may not, other clinicians may not have had time to do so. Yeah, I mean, I think, it's quite confronting to have the label of vulnerable being attached to yourselves. Many of the clients and the staff just saw it as a specialist GP surgery, and that was, the branding and the image that would be far more fitting. It was felt that the vulnerable wording was perhaps quite off-putting to some. They may not class themselves as vulnerable and then miss out on the opportunity to access that service. And it's quite stigmatising when they're having to fill in paperwork for, say, housing applications or even job applications, to have that name as to be labelled as a vulnerable adult and have that as your GP practice name is a bit belittling. I think the imagery that was used alongside the title was problematic for some of the service users and the staff. The imagery of chains, it's not very progressive. It's not really expressing the positive aspects of the support that takes place. And it could be particularly difficult for those who are perhaps asylum seekers or prison leavers, who have different connotations perhaps attached to an image such as chains.
Following a full analysis of the feedback, we made the following recommendations. Maintain the current number of locations for the GP out-of-hours service. Maintain the current Norwich Walk-In Centre. Keep the current Vulnerable Adult Service Health Inclusion Hub in Norwich. Consider renaming the Vulnerable Adult Service as people felt it didn't reflect what the organisation did, and produce a new logo which doesn't include chains, as these can put both former prisoners and asylum seekers off seeking help. And improve the way surveys are designed and responses are collected in the future.
It was very difficult for patients to understand, and I think rather confusing. They weren't provided with any options per se, and it was jumbled together. So if you were somebody with special needs, for example, who made use of the vulnerable adult service, it was unclear as to whether or not you were answering it as a vulnerable adult or perhaps as a person who was just using the walk-in centre as and when they required to. Yes, and the ICB to a degree did listen and changed the survey, but I don't think they changed it well enough, and I think that led to an awful lot of confusion. And as you know, we had probably about 4,500 responses, I think, towards the end, but about 2,000 of those weren't completed because people just got so frustrated and confused and made reference to that in the comments when they were forwarding it back to us. I think as an organisation, Healthwatch really came to the fore, and we were able to sort of not only add to our engagement events, but we were able to ensure that the engagement officers were fully briefed to talk to people about the potential of the walk-in centre closing. That was incredibly important because people are sometimes marginalised for whatever reason. They don't necessarily feel comfortable answering the surveys because there's a suspicion as to what might happen with it. And it's being able to sit down and explain face to face with somebody about what the potential options could be moving forwards. And we discovered a whole host of things. For example, the logo being used for the vulnerable adult service was something that they kind of felt suggested that people were manacled or in some form of chains. And rather than it really expressing what the service does, which is absolutely amazing.
You can read more and download the full report here.